For this edition of HCP Live House Call, I'm joined by Dr. Daley from the University of British Columbia about her abstract that was supposed to be presented at the ATS conference, which would have been held this week. Dr. Daley, I guess my first question is, what is the main takeaway that we learned from this study?
So the main takeaway is that we had a very unexpected finding of that, which had, and we replicate. So first is that we replicated a previously reported finding by the child study, which the epigenetic age of children with asthma at the time they're born, so using cord blood samples, their epigenetic age is older than their gestational age. That was first reported by the child study. So we replicated that, but then using a longitudinal study where we have data on children at 15 years of age. At 7 years of age, that difference increased, but by age 15, the epigenetic age and the biological age had come back to basically there not being a statistical difference between the two. So we replicated the findings of the child study that in early life, at birth and at 7 years, there is a epigenetically, their epigenetic age is older. At 15 years, there is no statistical significant difference. And then using data that we have from an adult sample, where they also have children, that is a family sample, we observed that, and this finding has also been previously reported, that adult asthmatics are younger on the epigenetic clock than non-asthmatics. So what we're hoping is that this perhaps also suggests, because there is a dramatic difference in gender shifting. So childhood asthmatics are predominantly male, whereas adult asthmatics are predominantly female. And that shift happens sometime during adolescence, early adulthood. So what this suggests to us is that these epigenetic changes are also tracking with this gender shift. And perhaps we might be able to get information as to why does that gender shift happen from our epigenetic studies.
Okay. Now, knowing what we now know about asthma in pediatric patients, how do you think that changes treatment?
So currently our results would not necessarily change treatment. Where I think that there may be a possibility for there to be a change in treatment is going to be if we can identify either an epigenetic signature, or if we can come up with, between genetic information, epigenetic information, that we can identify what we would call a polygenic risk score, or a genetic risk score that at birth would identify infants that are at high risk for developing asthma, atopic conditions. Then those kids can be targeted for intervention studies. A good example might be, I also work with food allergies, and early exposure has been known that can have a dramatic difference on the prevalence. So perhaps early exposure, for asthma, there are a lot of other environmental potential contributors. And so that's going to allow us to be able to identify potentially those that would be at highest risk.